There's good stress and bad stress. Good stress is the type that pushes us, motivates us, and stress piles on top of each other such that we cannot recover from it. That's when it's compounded. And then it becomes chronic stress, and chronic stress leads to disease. That's why stress is important. My name is Janester Wilson King. I am a board-certified obstetrician and gynecologist. I am vice president of the Society of Cannabis Clinicians, the oldest group of cannabis clinicians in the country. I'm a member of the Special Advisory Board for ACAM, that's the Association for Cannabis Health and Equity in Medicine, and I am on the board of directors for Doctors for Cannabis Regulation. Thank you for that question, Ethan. And first of all, I want to say thank you for your military service. Your PTSD was really a controversial diagnosis until about 1980, when we started taking it more seriously and recognizing that this is something we must learn how to take care of. And, well, cannabis can be effective in providing some relaxation. Cannabis can help you sleep because many people with PTSD do not sleep. Cannabis can help you change your perception of what's going on and maybe help you feel a little better about it and feel differently. Many veterans, many people with PTSD have been able to either stop all of their medications or certainly significantly decrease their medications, and it allows them to live a better quality of life. Thank you for that question, Esther. There are many women who have that issue in their 40s. What happens to women through their lifetime? They go through hormonal phases. The phase you're in, or maybe in, is called perimenopause, more than likely. And you can have hot flashes. You can be menopausal at 45. That means your ovaries aren't making any hormones. And you can have those symptoms, but they would be probably a lot worse than they are now. And we can do some lab tests to really check to see where you are. Cannabis can be helpful because, number one, it can allow you to sleep. Number two, it can calm that anxiety. Number three, it can put you in a better mood. But I will say this, as an obstetrician gynecologist who specializes in hormone therapy, as well as cannabis use in women's health conditions, perimenopause and menopause are about hormones and hormone deficiency. So hormone therapy will be your best place to start if you're a candidate. Thank you for that question, Jessica. I'm sure you're quite uncomfortable with your endometriosis, and I'm glad it was finally diagnosed. That's one of the problems with endometriosis. There's a delay in diagnosis. The prevalence is about 10 to 15% of women of reproductive age have endometriosis, and they usually suffer until they're in their 30s before it's diagnosed. We used to think it was a pelvic disease, but it's really a systemic disease, and we need to start looking at it more that way so that we can actually treat it appropriately. I've seen many women go from being in severe pain, not wanting to leave the house, being miserable, and the people around them are miserable because they can't help them. And using cannabis, they've gone to women who are having a quality life. They're able to function, they're able to hold down the job, and the best thing about it is they are able to have a healthy sexual relationship with their partner. Everybody doesn't fall in love with cannabis and think it's the panacea of medicines. So it may not work for you is number one. Number two, if you don't know what you're doing, you don't know what to take, how to take, and what to do with it. So if you take more than you should, it will actually create the symptoms that you're trying to abate. If you're trying to get rid of anxiety, taking too high a dose can cause anxiety, can cause paranoia, can cause irritability, and can prevent you from sleeping. So those are some of the adverse effects of cannabis. And the best thing I can say to you is if you're going to use cannabis for anything, find a cannabis clinician or practitioner and have a consultation so you can learn the nuances and ins and outs of how to use cannabis. It's not difficult, but it can be tricky at best. Just be careful and utilize cannabis clinicians or practitioners to help guide you.